Good evening, everyone. I am Jason Tierney with Transform Dental Sleep, and tonight's webinar topic is a mouthful. Can you say that differently? Communication tips for more physician referrals, higher case acceptance, and greater team engagement. So tonight's webinar is one that, frankly, is not going to be very well attended compared to many of our webinars. And the reason is because this isn't an especially compelling or sexy topic. It's not medical billing. It's not device selection. It's not which home sleep testing unit is best. Uh, but the reason this topic is so critical and why I commend all of you for being here is because this topic is the game changer. Communication, no matter which devices you use, which home sleep testing protocols you follow, you will not get your team on board. You will not get patients to say yes at a rate that you want to see, or get physicians to refer patients to you in a quantity that you want to see, unless you communicate effectively. It's key. It comes before everything else. So to all of you that are here, I want to commend you, your dedication to your patients, to your practices, and to the dental sleep profession. Truly commendable. So thank you. We've got two of our three panelists with us here. One of them, Lesia Crawford, was unable to join us because she has a drum lesson tonight, as in drums, throw the stick up, catch a stick, drums. So she won't be joining us. But we've got an esteemed group of panelists here. So let's dive right in and have them introduce themselves, because nobody likes to talk about themselves more than we ourselves do. So Chad, you want to hit that? Dr. Jason Doucette, who are you? Why are you here?
Let's see. So practicing 25 years general dentist, last 10 years treating sleep, TMD, you name it. And in the last 10 months ago, went full-time sleep and TMD, and here I am to hopefully share some pearls.
Yeah, and I'm certain you will. One of the reasons I asked you to be a panelist tonight is because you promised to buy me lamp pizza next time you're in Scottsdale. But
For sure.
also, uh, you incorporated sleep in a really meaningful way at a high volume in a general dentistry practice. So you are living proof that that's possible. And recently you did transition to sleep only. And
Yep.
I think that because of that, you've got a really unique vantage point, and everyone is fortunate to learn from you tonight. So thanks for being here.
Mhm.
And sticking with D's, Chad, there you go. Dr. D, you want to tell them who you are, why you're here?
Yeah, really pleasure to be here. I'm excited to chat with everyone here. I'm a general dentist as well, and I completed a fellowship in facial pain management in Boston about 12 years ago, and I have a TMJ and sleep apnea clinic in Ottawa for the past 12 years. Similar to Jason, I was doing general dentistry as well, and then started doing more days in the TMJ clinic. And since COVID, so about 3 4 years ago, not even sure when COVID was now, I transitioned to just TMJ and sleep. So I have a clinic there where I just do exclusively TMJ and sleep. I'm very fortunate. I work 3 days a week, and I book 12 weeks off in a year. So I really focus on a good work-life balance, and I think sleep and TMJ affords that to many dentists. So, my mission is just to get more dentists to do more sleep and more TMJ if they can, because you're helping lots of people, and you will also reap the rewards as well.
Yeah, and that was, thanks for sharing that. You and I had a phone call maybe 6 weeks ago,
Yes.
and I really appreciated your ability to convey complex concepts simply, which is
Yes.
key to quality communication. And your practice is very successful. And when we host these webinars, one of the things we really like to do, and it's the same thing with the Transform Dental Sleep Symposium, is we like to bring uh, qualified speakers that have been where the attendees are and are now where those attendees want to be, so that you can, kind of help lay some breadcrumbs out to show them where the trail is to get to where they want to be. So thank you a ton for being here. And then I'm Jason Tierney. I literally wrote a book on dental sleep medicine. It's called Transform Dental Sleep. And, you know, I have nothing to sell you, no products, no services, nothing like that at all. Transform Dental Sleep simply aims to provide a platform to help dentists and team members learn how to do dental sleep the right ways, so you can help more people go out there, live a healthy lifestyle, make a bunch of money, help a bunch of people, and it's a win-win. So that's our aim. And before we jump into the questions in a second here, quick housekeeping. You will receive your if you stay on with us until the end, you will receive your CE certificate in the next 48 hours. So check your email. If you don't have it in the next 48 hours, shoot me an email then, but don't email me in 2 hours telling me that you haven't gotten your CE certificate, because you won't have it then. If you don't have it in a couple days, then give me a holler, and we'll get it straightened out for you. But keep an eye out for your email over the next couple days for that email with your CE certificate. Also, down in the chat, you can add down at the bottom of your screen, you can add some comments, questions down there. We'll try to answer your questions in real time or get to them all during this session. One of my friends, Chad Wooders from Awaken to Sleep, has stepped in Elias's stead for the evening. Elias is on vacation. My wife's at drum lessons, and Elias is on vacation. Um, and Chad is managing the back end of the webinar tonight. So add your questions, your comments down there. We'll try to get to them all. And we're doing one thing that's a little different tonight too. So those of you that have been on our webinars in the past, we usually take 8 to 10 questions that were submitted at registration. Tonight, though, what we've done is we've segmented the questions into 3 categories. Those are case presentation, so patient interaction, patient communication, physician communication, so generating referrals, and then lastly, team engagement, so team communication. And we're really just going to kind of have a conversation around each of those 3 topics. So I'll make sure that I weave your questions that were submitted previously, weave those into the conversation. But this way it'll be a little more free flowing. But keep your questions coming in. We'll try to get to them all. And with that said, let's hit that first one, Chad Wooders. So team communication, listed this first because without this, without the team being involved, the team being engaged, no one knows what anyone's doing, right? Mm-hmm. And without this, we don't have a strong foundation on which to build everything else. And I think that oftentimes this is the one that's most overlooked. So we're trying to build a house on sand. Jason, you've lectured extensively. You've worked with practices all over the country. What are the primary issues that you see dentists in sleep running into when it comes to team engagement?
Oh, well, well, I think it goes without saying, this is, as you kind of mentioned, and in a roundabout way. This is kind of a team-driven approach, right? It's not your typical general dental practice, right? Where the doctor physically does all the work, the team kind of supports the admin, the setup, cleanup, suction, and that's it. It's kind of a little bit of a, I wouldn't say a flip-flop, but it's definitely a paradigm shift for sure, where it's kind of like an ortho practice where yes, the doctor has his or her part to diagnose and make decisions on the fly, to treat the patients, but the team is empowered to do all the physical work if they're trained properly. So I think, understanding that you can do a lot more with your team, get them more involved in helping these individuals that are suffering. So that's empowering in and of itself. So training becomes a big deal there. But I think the biggest pitfall that I see around that is that some doctors, because they're so busy with their general dentistry practice, and I was in that same boat, is you got to get the crown preps done, you got to produce, you got to pay the overhead. If you don't slow down in a sense to speed up with this, like other things that you implement, and train the entire team from the front office or the front desk all the way back to every individual in the office, hygiene, assistants, etc., that are fully educated on what we're doing and why we're doing it, that's a big pitfall I find. Whereas, the last thing you want someone to ask is, call into the office and ask about sleep apnea or snoring, and the front desk just says, hold on, let me go ask what we do about that. Like,
Right.
that's just not a good, right?
Some with that, I mean, oftentimes I talk to practices, or I've talked to practices over the years that think that, well, here, I'll pull from my past life running a dental sleep software company. And one of the things that would happen is, sorry, I've got a cold. One of the things that would happen is a dentist would go to a course, subscribe to the software service, go back to the practice. If they said anything at all, they probably said, "We're going to do this sleep thing, um, and I signed up for the software. They're going to call you." And they mistake that as communication or delegation. So in a situation like that, I mean, you're that dentist, you go to the course, you subscribe to the new software. How do you communicate what will happen next to your team?
Yeah, exactly. So I think that's a big pitfall that many dentists do, me included. You go to a course, get excited, you come back thinking, you're going to implement this, and then you hit a brick wall when you get to the clinic with your team. Everyone's kind of giving you that that look on the face, like,
Yeah.
what is it? What's this guy on? So, as Jason said, it is really a team approach. So your team has to be 100% in. And before you go on full speed, full throttle, you actually need to get your team on board, and you need to do the proper training and get them really properly excited, understanding what they're doing
Well,
and
let
what
me
the new
let, let
team.
me can I pause you there for a moment?
Yeah,
Sorry to interject, but I heard what you just said, but we're speaking kind of nebulous terms.
sure.
So
Yeah.
this is again why this webinar is not popular, because it's not it doesn't have anything to do with acrylic or nylon.
Exactly.
What you're talking about. Please take
Yeah.
us deep in the weeds. So
Yeah.
how do you get the team excited, and what would you say to them to communicate, what the vision is going forward? What does that
Yeah.
actually sound like?
So you have to actually come up with a vision, and you have to work with your team. So, like, I every year we actually have a full day. We have meetings monthly, first of all, but once a month we meet. I order breakfast, and we have a 2 hour meeting to go through, things in the clinic. And once a year we do a full 4 hour vision building statement, where because every year, things change, or my goals change, the clinic goal changed. What are we actually doing and why? So, as the book, Simon Sinek starts, start with why. You have to actually have a very strong why. And as the leader, as a dentist, you actually have to come up with that vision, and then you have to be able to, get your team on board. And if you're very clear about it, and you're a good, boss, most of your team will jump on board and be willing to kind of take that vision as their own. You have to find things for them to get excited about as well. So, in our clinic, we have a vision board where everyone comes up with, we do bonuses in our clinic. So every month, after a certain, a benchmark, everything above that, I give a percentage of that amount to the team because they're the ones making everything happen for me. So we come up with, how we'd like to spend that money on. So we have a vision statements of things to get the team excited to stay on track. And actually, I do believe in a bonus system because it helps everyone kind of focus and work just a little bit extra hard to, we get someone there for an annual follow-up. And that person's like, hey, I'm thinking this appliance is getting a little, loose. Do you think we should do a new one? And we're like, yeah, of course, we can do that right now. So that follow-up quickly flips into a scan and, do that. No one's, huffing and puffing about it because they know there's actually something in for them. So,
Yeah.
those are the types of stuff that I do with my team.
Yeah, there's all these, there's a ton of surveys and research to support that money isn't a primary motivator for most employees. And it may not be a primary motivator, but it's certainly a secondary motivator. And, on the topic of communication, money talks. So having bonus plans like that certainly can help motivate. But again, I think not as a primary motivator. Your team, I'm sure, they're aligned with your vision, and that's why they're there. The money is just, the cherry on top, and it gives them something else to strive for. Um, you know, what about Jason? You've been doing this you're a young looking dude, but you've been doing this for a while. Uh, you've had some team members that, excuse me, you've had some team members that weren't aligned with the vision over the years, I'm sure. So some of those people, well, let me say this, let me ask this differently. Oftentimes in practices, I've heard that, you can't let Susie or whomever go because they've been there forever. But frequently that person is really the bottleneck. They're the barrier to growth and progress because they're insistent on doing things the way, the status quo. Um, so when you've encountered a team member like that, Jason, what have you done? How have you managed that communication to get them on board or get them overboard?
Yeah, that's a big question. I mean, I'm thinking of my general practice days too. I've been a firm believer that, one sour potato spoils the bunch, and no matter how great they are, I've had someone that was a rock star front desk, did everything right, was great for me, but caused a lot of problems with the other team members. And when one of my star team members finally came to me and says, I can't do it anymore, push came to shove, I let that other person go because it doesn't matter how good they are if it affects the team like that. So you got to get rid of. So I'll say that, but I'll also lay this out that I've also learned too, even more recently, that sometimes it's not a matter of the employee is not a good fit in your business or your office. It's just they might be in the wrong position. So sometimes you got to vet that too. Maybe find out what they like, what they dislike, what they're good at, what they're not, and shift them around. But if it's a
Sure.
character issue, obviously, attitude, etc., then yeah, you just cut bait sooner than later.
Yeah. So in a situation like that, though, where maybe there's misalignment on, their role and their abilities or their interests,
Yeah.
how do you identify that?
Well, it's usually through job descriptions. Well, let me back up. So recently I retained a consultant, and so the first thing we did is I said, look, let's just get a lay of the land, or they did, and they basically gave everybody in the practice something to fill out, every team member to say, what do you like? What's the least likely? What's the thing you like the least about your job? I believe the
Mhm.
most, among other questions in there. And that was real telling because, we had someone at our front desk that the thing she liked least about her job was answering the phones.
Ooh,
Hello, that's your job.
yeah,
So that was enlightening to know. So
yeah,
is she a good employee? Yeah, she's a good employee, but maybe she's slightly in the wrong position. So in a dental sleep practice, fortunately we have other needs besides just front desk. Like medical billing, could be back in an office where that person may not have to answer phones and could communicate all day long with our third party biller, submitting, billing forms, all the paperwork, et cetera. So there's a way to, utilize that person without saying, okay, we don't like answering phones. Maybe we need to part ways. It's like, no, so we're keeping that, we've got that in mind, so to speak, right now as we speak.
sure. And Hassan, what about yourself with team members that maybe you need to separate from the practice?
Yeah.
How do you identify that sooner than later?
Yeah, so I've always followed the motto, hire slow and fire fast. So I don't really believe in taking someone that is a C
Mhm.
minus and thinking that I could some sort of magic special person. I'm going to be able to take them to be an A plus really employee. So I take time to hire, but if I follow my my gut. So if I just don't feel this person really has good work ethics, then I let them go pretty early on. Like you can always train for skills, but attitude you can't. So if they're lazy, if they're finding time to leave early, have these my car broke down, my this person's sick and I have to take care of them. you know you make excuses for the beginning, but then eventually I think I get a feeling that this person is just not a good fit. I really want someone there in the clinic that is going to be A plus. If I could also uh, add to what Jason was saying, which I agree with. I One thing that I also really do is I actually do personality tests for the clinic. I really follow.
Mhm.
I believe in the DISC personality, the four personality types,
Mhm.
the dominant or doer, talkers, supporters, controllers, and I really do cater to their strengths as opposed to try to push their weaknesses away or try to turn them to someone they're not. Like, one of my team members is very, super extrovert, talkative, so I put her in a treatment coordinator role so she can connect with people and she jokes she can sell, ice to an Eskimo or something, which is probably politically incorrect to say Eskimo, but like she can sell ice
It
to
is.
anyone. Yes. So
Mhm.
she could do that. Like she can sell anything to anyone. And so I have her doing that role. I have someone else that's more, introverted, more analytical. So then, I have that person doing
Sure.
our numbers and managing the clinic. So I don't particularly push people to do things that are outside of their comfort zone. I like to push into their strengths and offer them more that they could do and grow in these roles.
Got it. Real quick, what's your what are you highest on in the disc profile?
So I did this actually today, believe it or not, because I'm working with a charity and as in the executive team, and it was my idea to see our personalities, and I'm double D, meaning like I'm a doer, dominant, dominant. It's called the captain or something. So
Yeah.
uh, you know,
Mhm.
uh, that's what it is.
Anybody that's on that's had a disc profile, throw in the chat what your highest score was. What about yourself, Jason? What are you?
It was like 25 years ago. I remember I was a high D and low
Yeah,
C or something like that. It was something
got it.
like that. I was definitely not an I, the influencer or
Got it.
whatever that person is, but
Are either of you still involved in the hiring practice in your office?
Yeah, I do. I'm
Okay.
still involved in it. I usually, of course,
Okay.
have my clinic manager vet and look through the resumes, and then she picks the top 10, and I briefly look at them, choose the top five, and then I interview them with my clinic manager. Uh,
Okay.
but I still am involved in that to choose who I think is best for the clinic.
So
What is one red flag um, during the interview process?
Well, if they flake out and show up on a different date, that still
Sure.
happens. So
Yeah.
that's it. And for me, if they've moved a lot, like from clinic to clinic, they just can't find
Mhm.
a happy home somewhere.
Yeah.
I'm just going to be another, just like a patient that comes to you and complains about the previous 10 dentists that they saw and what they did wrong. You're not going to be any different.
Got it. Got it. Jason, anything you would add to that? Any other red
yeah,
flags?
I was gonna say I'm a little bit the opposite. I'm not. I'm involved in the hiring now, but what I have a front office manager and a clinical office manager, and I, submit to the fact that I'm pretty good judge of character. But if we're, as far as genders go, my gals, if we're hiring a gal, I said, you guys, have a third sense that I do not, and you can sniff things out. So, having said that, I say, look, if we're hiring a clinical person, I think you should be the one to go through, find resumes that you like, bring them to the table, interview them. And if you find that they're qualified or one that you're interested in, then I can come in and say hi and give my blessing, so to speak, because at the end of the day, they know what we need, what we expect, what we want more than I do because of their positions managing the clinical side or the admin side up front. And so I'm involved in that respect on the back end. But the other thing I wanted to say was as was just mentioned, if I'm looking at resumes, the first thing I look at is their employment history. That's like if right away they've only been a place a year or two for the last 5 jobs, it's not even worth talking. I want
Hmm.
someone who's been somewhere for at least, 3 to 5 years or longer, and then look at where they were, and then that kind of gives me an insight as to they're looking for a home, they're committed, whether it's a good or bad environment. They don't just fly off the
Sure.
handle and say see you later or been told otherwise.
Got it. Let's switch gears from team communication to patient communication and talk a little bit about
Where
uh,
where's Lesia?
what's that?
Where's
Yeah, yeah, yeah,
Lesia?
yeah,
You should have her
yeah.
lead this whole part.
Well, she was going to, but drum lessons called.
Man, we're all missing out on that, but that's okay. We'll do our best.
Yes. Yeah. So one of the things that I see dentists get in their own way oftentimes is delving too deeply into clinical jargon with patients.
Mhm.
You're shaking your head like at first you were nodding affirmatively, like, yeah, I know that guy. That was me. And then you shook your head like, but it's not anymore. So talk to me about that, Jason. How do you communicate? How do you convey to a patient what's going on in understandable terms?
Well, okay. So two parts, depending on which appointment, because there's two different sides of this for an initial patient. I will say that again, referring back to what you said, for me teaching lots of courses on this over the years, I'm thinking of a few dentists that would call one specifically, hey, I started screening all my patients, tons of patients, definitely have this problem, and I'm talking to them, but nobody's scheduling back for any treatment. I don't understand. And I go, okay, well, walk me through what you're doing. Well, I'm going in to do a hygiene check and I see a Mal and Patty and look at their medical history, yada, yada, and go, okay, they're at risk. Start talking to them that they probably have a sleep disorder breathing problem. And then I go into all the different deep physiological problems they're probably having and
Yeah.
this, that, and the other. And I said, whoa, 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 stop right there. I said, you
Bruh,
literally
I was
just
here
met.
for a trophy.
Yeah,
You
I
know,
just walked, I said, so yes, exactly, which is in your book. I believe you mentioned something about this, but these patients come in on a lunch break, they're getting their teeth cleaned, or they gotta go to work after their prophy appointment. They're not thinking about this other thing that we're hitting them over the head with or bringing up. So I learned right then and there that, and I told this doctor, I said, what you want to do is look for one or two or three things that are hidden that they're probably suffering from and bring that up in a way. And that's the hook. And it's only a minute or two conversation of, you know, hey, I looked in the back of your throat. I noticed the soft tissue, the way it's set up, and you use simple words and say, it looks like you might have a sleep disorder breathing problem. And usually I preface that with, hey, Mrs. Smith, I talk about their teeth first, and I say, and by the way, this is kind of weird coming from your dentist, but I noticed X, Y, and Z are on the medical history, and so I was just wondering, like, how do you sleep? Do you go to sleep and stay asleep all night long, or do you wake up throughout the night or use the restroom, have morning headaches? Oh my God, yes, all those things. How did you know that? Ding, ding, ding. There's the hook. You know what, Mrs.
Mhm.
Smith? I think there's something going on when you're sleeping, so I'd love to get you back for a complimentary, sleep screening appointment. We can talk more about this, and I can help you with that. That's it.
Mhm.
That's the hook. Okay. So moving to the next part of your question or answer it when they're in the chair for an actual sleep screening, when I have them, they're focused on now what we're going to talk about when they come back. The main thing with that is I found always to focus on their chief complaint or chief disability, as we call it. What is really the problem? Are they not sleeping in the bed with their partner the last 20 years? Do they have morning headaches? Are they, snoring's a problem? Whatever the issue is, and come back to that. And that's usually what we focus on with whatever the results are to move them forward and educate them on all the treatment modalities and that they need treatment, whether it involves us or not.
And that chief complaint, it's likely in some sort of documentation, but also I think it's vitally important to listen because there's a strong possibility that they could drop some tidbit of information that's vitally important that you wouldn't hear, that you wouldn't pick up on if you don't actively listen. Is that fair, Sam?
100%. That's my main sleep assistant, and I don't mean to take it over, but that's her main thing when she's vetting a patient in an initial sleep screening appointment. She is listening more than talking, and she will ask certain questions to elicit, open-ended, how does that make you feel? What do you feel like's really going on? What's this causing? You name it, and just writes everything down. So when she comes to me, I get this full picture, and she's already
Mhm.
talked to him about all these signs, these symptoms, and just, things they're suffering from. And then she starts to hone in on right back to the main things they're suffering from if we're talking about a sleep test and those symptoms. So yeah, the hearing is more valuable for sure.
Sure, sure. And Hassan, what about yourself? I mean, how have you honed your, scripting or talk track over the years so that you can connect better with the patient when presenting treatment
Yeah, so I
or when
think
discussing treatment?
yeah, so first of all, I think you kind of hinted at something that's very important, which is script. So we follow a script. So anytime we do a consultation, so I'm very blessed to be in a position where our clinic is referral based. So we get patients being booked, they're coming from referrals. And so they're coming for sleep or they're coming for TMJ. So we have a time with them for these things. And then we can really straight from the very beginning start asking the questions. So we have a script, and every single consult that I do is identical to the next one I'm going to do, which is going to be identical to the third one, which is going to be identical to the fourth one. It's a show where you're going and we're doing a kind of like, it's showtime and everything just has to be
Mhm.
right. My treatment coordinator knows what she's doing. My phone intake person that booked them in originally has her script and does the questions. And all we're trying to do is get them talking about their problem, realizing that they have a problem, imagining that solution. How is that going to look like? Get them excited. think from their emotional side about the, why they're there, how it's going to feel when they're feeling better, what would that look like? So then, everyone does their part, and then I come in the very end and just kind of, present the case. But even with me, I'm actually still trying to cultivate more of their why they're there. Especially, usually there's been an issue for many years, as Jason said. Maybe they haven't slept in the same bed for many years. I always ask one very important question is, why now are you here? There's usually something that has happened recently that just kind of made them realize that there's a problem. And you want them to vocalize it. Like, you actually want them to themselves say, I'm here because, I can't handle this anymore. Or, falling asleep, while my kids are playing, and I'm just so tired. You want them to admit that they have a problem. You don't want to tell them that they have a problem. Who, they're not, who cares, but they need to know, and they have to say it themselves. So it's about finding ways to get them to vocalize it and have them hear themselves say it.
So let me capitalize on that if it's okay, Jason. Let
Yeah,
me
please.
he hit on a certain point, so it was really great. So I didn't come up with this, but I think it's great. I'll just, to extend that, is when we find the chief complainer, what they're really suffering. I mean, there's usually a multiplicity of things, right? But usually there's one main thing. Like, I wish I didn't have a headache every day, all day. I wish I slept back in the bed with my husband or my wife. I wish I didn't get up to use the restroom 5 times in the night or wake up feeling depressed and anxious. And so then we turn that back around in a positive way, which was just said is, Mrs. Smith, wouldn't it be nice if you were able to sleep back in the bed with your husband? Wouldn't it be nice if you could go out and play soccer with your grandkids and not feel lethargic and foggy? Wouldn't it be nice if you didn't, Mr. Jones, wake up with that headache you've had every day? What would that be like? Because what happens, as what was just discussed, is now you get them in a different frame of mind of you're instilling value in treating this condition. So we're not focusing on how bad the sleep apnea is. That can be part of the conversation, but it's not the main focus, because what drives people is the value of how in the now, right now, their QOL, their quality of life, how that's going to be improved. Most people I have found, even the ones in their 70s and 80s, are not really concerned about the cardiovascular event they could have now or in the near future. Okay, some are, very rare. It's more like the quality of life they're going to experience now, whether they get on a CPAP, use an oral appliance, get Inspire or surgery, whatever. So when we flip that back around and say, what would it be like to actually not have a headache every day, or to have this acid reflux or whatever? Now, when they transition to our financial coordinator, if it's that day, to talk about insurance costs, their portion, what do they pay out of pocket, if anything, the money's not an issue anymore. It's just like buying a car that you really know you want and see the value in. Now it's figuring out how you can afford it and fit it into your budget. Whether you need financing, you can pay for it, because at the end of the day, you have a problem, you see the solutions, you've already envisioned how it's going to feel to not suffer like this anymore and all the benefits. And it makes the financial part a no-brainer,
Yeah.
which is usually the biggest complaint for conversion.
By shifting that to a positive, I mean, you bridge the gap between their negative current state and, this vision of a better tomorrow. You've bridged that gap for them.
Huge. Yeah, it's huge.
And put them on that path. Yeah. I love it.
Huge.
I love it. What about a patient that says, how do I know this thing's going to work? I mean, this all sounds great. Is it going to work?
You want to take that one, Dr. D?
Sure. Yeah. I think I usually just say, I've been doing this for 12 years, and, I've done thousands of appliances, and, patients in a similar situation as you that have, mild, moderate apnea, we see this and this. So if they're asking that type of question, they tend to be more of a analytical, maybe, again, that personality test, we kind of use it for everything. And even with our patients, my treatment coordinator is supposed to come and tell me a little bit of what she thinks their personality is. So then I go and speak their language. So if someone is a C, really is about numbers, more kind of suspicious, then from the beginning, I'm actually just talking percentages. We 80% of our patients will feel this at this point, XYZ, whereas someone else is different. So, that particular question, I would be giving stats because that person sounds like they're interested in that. I say, obviously, we can't guarantee that everyone's different, where it's a human being. There's some science and art here, but
Yes.
based on what I've done here and what I know through research, your case is likely to be very successful. Appliances are designed for someone like you that has a small jaw and a large tongue. So I kind of go over how his unique situation matches what we're trying to achieve here. Again, it's about knowing a little bit who they are and then speaking their language.
Talking on the topic of speaking, Jason,
Mhm.
last year you were a panelist at
I
the
was.
Transform Dental Sleep Symposium.
I was. That was fun.
Yeah. And I know that you're coming this year,
Yeah.
January 31st and February 1st in lovely Scottsdale, Arizona, where the high
Yes.
today was 78 degrees.
Quit bragging.
Yeah. Uh, so that's coming up January 31st, February 1st. We've got 20 or so speakers, and we're covering a full gamut of topics. Chad, if you want to roll to the next. There's a veritable who's who of speakers, but here's just a couple of the lectures. Dr. Stacy Lehman, who has probably one of the top five busiest, and Lesia, one of the top five busiest sleep practices in the world. We'll be talking about how they built their culture and scaled their team, across three offices. Dr. Aaron Elliott, whom just about everybody, if not everyone on here knows, we'll be talking about, seven of the highest hurdles that she overcame, what she learned from them, and how you can learn from her mistakes, turn her mistakes into your success without going through all that pain yourself if you're smart. But really, we're covering topics about everything from remote patient monitoring and the future of dental sleep medicine to breakthroughs in TMJ treatment with Dr. Jameson Spencer. But a lot of it is really focused on pragmatism. It's practical information. The focus of this meeting is actually, it's my meeting. I'll just tell you. The emphasis is on providing energizing or energetic speakers on practical topics, giving you actionable information that you will actually put into use. There's a bunch of variations on this quote. Excuse me, a bunch of variations on this quote, but education without action is nothing. Knowledge without action is nothing. We want you to come to this meeting, have a great time, have fun, learn a bunch, but put it into action. Otherwise, it's really all for naught. We all just kind of pat each other on the backs and go, "Oh, aren't we smart? Aren't we boring dinner guests?" Because we're talking about malin patties or whatever. That's not what this meeting is. This meeting is to help you learn more so you can do more and you can have a more rewarding career. So that's the aim. I hope you'll join us. You can sign up at tdssymposium.com. We do only have, I think, 13 rooms left in the entire hotel. So you save a couple $100 per night if you get registered. But there's 13 left. So once those are gone, there is no more room at the inn. Jason, you were there. Beautiful venue. Yes.
Yeah, that was not that it's all about that, but it is for me. I kind of like bougie places. So it's definitely a nice new bougie. Is it Marriott? I think it's a Marriott.
It's a Hilton.
Or Hilton, sorry.
Yeah, this
And
way.
just the views and just the conference room, the whole gamut. I mean, it's in a beautiful area. Yeah. So I'll be there not only just for your 2 days, but I'll be there 2 or 3 days before and a day after to really just take advantage of hanging out with different people that'll be there to play golf and enjoy the weather. And yeah, it's an awesome meeting and an awesome place to have it. So yeah, top
Thank you.
notch.
Yeah, last year we did it. I had no plans to do it again, or we had no plans to do it again. It was so well received. It was so well attended. It sold out. And so we were like, I guess we better do it again. So get registered. Hope to see you there. TDSsymposium.com. Also, I mentioned at the top of this, I'm a little uncomfortable doing this, but I mentioned at the top of this that I wrote a book. That's it there, Transform Dental Sleep. If you find any of this useful, I strongly urge you to pick up a copy of the book. It is really a communication book, in the framework of a dental sleep practice. Well, Jason, you were featured in it. Sam, I know you read it as well. Useful for communication. Any tips, tidbits, techniques you picked up that helped you with that?
Absolutely. The whole book is amazing, but especially the patient communication. Like as we said, this is really what will drive your clinic to a higher level. So I highly recommend the book, and I
Yeah.
actually reviewed it online because it's great. And it's funny. I was expecting it to be so
Mhm.
funny and witty.
It is. It
Well,
is. And
thank
there
you.
even being in sleep as long as I have been, I'm reading the book and I had my highlighter out. I'm on
Yeah.
vacation in my trailer near a lake and was just reading it, for the joy of listening to you talk and be funny. And my gosh, I'm
Well,
like, wow, that's good. And I'm highlighting stuff. So yeah, it's not only entertaining, but it's full of a lot of great wisdom for sure that we've
thank
all
you.
learned along the way.
And if you haven't read the book, I mean, look, I'm certainly not retiring from book sales. But I wrote this book because I've helped a lot of dentists grow their sleep practices. And this was a way for me to sort of scale that to a larger audience. Um, and if you haven't read the book, it will help you. So pick it up. But Jason Doucette, you got to step up your game, my friend, because you're on here with not one author, but two authors. So
Oh,
this is Hassam's book, Heal Your
nice.
TMJ, and it is also a very practical. It is not your typical uh, uh, clinical TMJ book. It has a lot of character and personality. So I want to advocate that everybody picks up my man's book. Where can they get this? Where can they order this from?
I believe it's on
Yeah,
Amazon as well. Yeah.
All right.
Fine.
So here it
I can't.
Heal your
is.
TMJ.
Okay.
Chad is going. Yeah, heal your
Thank you. Thank
TMJ.
you, Chad.
Chad is going to. He just put it
Yeah.
in the notes. So
Thank you.
I strongly urge you to order a copy of the book. It's a fun read. It's a quick read,
Yeah.
but it's full of it's teeming with pearls.
Yeah.
And with that said, I want to dive into the
Wait,
next segment, which is
Chad,
physician. Yeah,
Chad, will you email me the link to that book, please? Sorry.
Thank you.
we will. We'll
Thank
be
you.
sure you get it.
Okay. Awesome.
Um, so this physician referrals, this was actually
Mm,
the category that we got the most questions about.
love
And I'm
this.
going to summarize or synthesize all of the,
Mhm.
dozens of questions that we got on this topic into one. And that is, I go to meet with physicians and they're basically like, get lost, dude. So So, Jason, if it's okay, we'll start with you. We're going to go alphabetically with last names here. Jason,
Mm,
I mean, your
well,
practice is it thrives based on physician
mhm.
referrals.
100%.
How'd you make that happen?
I don't know, a lot of sweat and tears, you know?
Okay, well, tell
Um,
us about it.
yeah. So, after, if you're starting out in sleep, I always did, you've got to practice right in front of you with patients that are suffering all day long. 30-40% of everybody you see has some form of sleep disorder breathing, right? Your hygiene patients. So you don't really need to run out there and start talking to physicians. So you've got those patients to screen, your team members, their spouses, their family. And then as you get going, for us, it was about probably a year and a half out where we kind of combed through the practice pretty well. And I thought, okay, I need to start venturing out. So, I had a friend that did a lot of catering to hospitals. And so he and I got together and he's like, I know how to get into offices. You just got to feed the whole office with a great meal. You could do a pollo loco, but something a little nicer than that's better usually. And then just ask for a couple minutes in the break room to talk to whether it's nurse practitioners, the MDs or MAs or whatever. And so we did a lot of lunch and learns, did a couple a month years ago and learned right away that what you just mentioned, I did get some of that. My three biggest hurdles when I was getting into sleep and wasn't even going to do this were I got to deal with medical billing, nightmare, don't want to deal with it, don't understand it. That's probably going to sink me. Two, I got to work with MDs. They think we're JRs, we're JDs, we're junior doctors. We're not real doctors, we whittle on wood, but teeth as well. So the respect isn't going to be there. And then I can't remember the third one, but back to this. So I just thought, well, we'll just start doing some of these lunch and learns and see what happens. Well, what I found was most of the doctors were pretty nice. We got some attitudes here and there. And I did get my rear end ripped up and down one day by a pulmonologist. But I found out later it wasn't because of me, but it was because of what was happening in the industry and home sleep tests versus PSGs, yada, yada. But after that guy ripped me up and down in the lunch and learn about everything he knew and what he wanted me to hear, which was him talk, which was fine. I walked away in that parking lot with my team saying, we'll probably never see a referral from that guy. He was my biggest referral for 2.5 years until he closed his sleep
Wow.
clinic of 15 years. So you just never know. But what I did learn is you keep it simple when you talk to these physicians. So I just found a physician recently that didn't even know oral appliances were an option to treat sleep apnea. Only thought CPAP was it. So you mentioned, hey, we're here. We treat, sleep disorder breathing. We're one of the few options. We bill medical insurance, Medicare, et cetera, if that's what you do. And we can get patients in pretty quickly for, either complimentary or a very low office fee and, help get your patients treated on the right road to recovery. Something very simple like that.
So
I don't know how far
it's
you want me to go.
it's a succinct message, and you're speaking to, really you're kind of going in there equipped to address the most common questions or
Right.
pushback
Right. So
that you've heard over the years.
right. And for most physicians, whether it's primary care, but if you're getting into this newly, you could start with primary, but pulmonologists, ENTs, cardiologists, those are the main ones, right? That understand sleep disorder breathing. Primary is getting there better. But when you go in, since they already know about CPAP and they know it works to some degree, and that's what they refer for, bring in a tap pad. That's what we used to use because it's cool looking, even though we don't really prescribe it. Something where it's a combo of CPAP and oral appliance therapy. Why? Because visually it's stimulating. Oh, wow, you actually do refer patients for PAP therapy. Oh, yeah, we do all day long, but look what we can do with an oral appliance. That gets them talking. So visually that, maybe a couple other just single oral appliances, some information of how to refer to your office, and then talk to them about how you get patients sleep tested or if they have that facilitated already. And again, go back to the main thing. For us way back in the day, we wanted no barriers financially. So we accepted all insurances, Medicare, all commercial plans. We didn't charge for initial visits. So we said, look, send them to us. It's no fee to see us. We'll screen them and we'll bill their medical insurance, their Medicare. We'll get them treated. We'll refer them back to you. And that was it.
You made it easy to work with you, and you succinctly addressed their concerns.
We did.
What about yourself, Hassan? What's been your sort of golden ticket and collaborating with physicians.
Well, I think what Jason's saying is correct, and also just keeping them updated through update reports and consultation reports, and approaching this as a profession that you're trying to do in the highest level of professionalism. So if you have HSDs that you do for testing your appliances afterwards. You send those back with a report when you're finished treatment to show them that you're titrating your appliances, you're testing them out. You feel that they're at the right position. You send them back to their sleep physician. That you're not just kind of taking these patients away and doing God knows what, but you're actually doing everything by the book, and you're sending them back to the sleep physician to kind of close in the loop to decide what to do next. They're still the team captain. You're there to help them. You're there to offer a solution to a problem they have, and you're not just trying to take their patients away or stealing their business. No, in fact, you're there to help. You have patients that are struggling with CPAP that you want to help. I have a solution here. Let's see if you're able to help. So you come in from a point of view of wanting to help, not just some sort of competing medicine versus
Yeah.
dentistry. It's not about that.
Yeah, I don't think this happens as much today, but there was a period of time when every dentist that took a CE course on sleep would barge into a physician's office and go, look, I've got this piece of plastic here, and I went to a course, so send me all your patients because CPAP sucks.
Yeah.
I don't see that happening as often as anymore, but for dentists like the two of you, going into an office like that can create a little bit of an uphill battle because first you've got to undo the damage that previous dentist did. So you're starting at a disadvantage a little bit, yeah. So in a situation like that, Hassam, I mean, how do you counter those past experiences and show them that you're different?
So what I find best with a lunch and learn, and I do many as well, and I just have, and for dentists that are thinking of doing this, just make one, just one lunch and learn, and then one presentation, and you're just doing the same presentation over and over again. So it's not like it's a lot of work. Just you do the work once, and then you'll be able to reap the reward from that one presentation. For me, what I find works great, and what draws the sleep physicians in, or other types of ENTs, other MDs, is the topic of just current guidelines and current updates to literature, because they don't know anything with dental sleep medicine. They as you mentioned, some of them don't even know that this the oral appliance therapy even exists. So I always go in with a point of, hey, I want to update you on the current guidelines and the current literature on things. So I go in from a scientific kind of point of view, not trying to sell them, look at this appliance, look at this, but really, and of course I take my appliances there with me, but it's more of okay, this is what the guidelines say. In fact, even for severe cases, oral appliance therapy is a choice in some cases. So, and this is what the literature shows. So, and then that helps them. As you're saying, they have this perhaps a image of the dentist just doing their thing and not just kind of not following any sort of data or guidelines. But when you go in showing that there's clear data and guidelines, and in fact that they're not the ones following those guidelines, we are following guidelines. So it's a little bit of in a nice way of kind of gently letting them know that they need to follow suit.
It's a professional nudge.
Yeah.
Yep, because at the end of the day, those AASM guidelines, the American Association of Sleep Medicine, which is pulmonologists and neurologists, you're walking into them and you're saying basically in a nice way, just so you're aware, the informed consent you give when you're giving treatment options needs to include the therapy that we provide. We don't say it like that, but like you just said, I forgot we actually would laminate those guidelines and highlight the two or three standards of care, and laminate it and put a sticky with the doctor's name on it when we go do a lunch and learn. So it would hold more value and not get thrown away. And when it hits the doctor's desk, he or she, I can assure you, will be at least compelled to give it a minute or two read, and especially the highlighted standards of care to really bring out what you just said. And that's huge.
What a great tactile tip.
It's,
there's
something about that.
That's golden. Yeah. To be able to touch it, hold it, see it, and it not just being paper. Yeah. So I want to be mindful of your guys' time as well as the people that are on tonight. So I want to ask you, Hassam, you've got 20 words or less. One tip for everybody on communication. Go.
I think it's scripts, to be honest. I live by scripts, and I have a script. My team coordinator has a script. Everyone in our clinic has a script. As I said, it's a show, and that's what we do in our clinic. So if the dentist on this call don't do that, that's what you should be doing ASAP. So to improve your communication style and systems with your team and the patients.
Jason, 20 words or less. One key takeaway for everybody here regarding communication.
Use your ears more than your mouth. The patient will tell you what is wrong. In the case of TMJ, I know you'll agree with me. TMJ is not hard to treat. The patient will tell you what's wrong, as long as you know your anatomy and treatment. In sleep, the patient will tell you what is the most important thing they're suffering from, and that's what you need to tie their diagnosis and their sleep apnea to when you're talking about treatment options and moving forward. Listen more than you talk.
Hassam, favorite food in the world. You can only eat one food for the next week. What is it?
Pizza, chicken wings, or just pizza.
Jason, you?
Oh man, probably a grilled ribeye with salad all day long, every day.
All right. Chad, hit that slide, would you? I want to invite everybody to join us 2 weeks from now for the next webinar, Home Sleep Testing and the Dental Sleep Practice, with Aaron Elliott, Dr. Singh, Ryan Javidbach, and Elias Kalanzas will be moderating that one. So same time, December 10th. We hope to see you there. And then I mentioned the Transform Dental Sleep Symposium earlier. What I did not mention is that the day before the meeting kicks off, so this is Thursday, January 30th, we are hosting a deep dive workshop on dental sleep practice marketing. It'll be hosted by the guys from Sleep Apnea Leads. It's from noon to 6 on Thursday. They're basically going to give attendees their entire playbook on what they do for practices. So if you want to come in early, we encourage you to do so and get registered for that. That is limited to just 35 attendees. I don't remember exactly where we're at right now, but it is getting full. It likely will sell out. So get registered. You can do that at tdssymposium.com as well. And again, I hope to see you there in January. These guys, Dr. Doucette, Dr. Down, thank you so much for being here. I know you both have busy schedules. You joining us in the evening and being so open, sharing your knowledge, your wisdom, your experience with everyone. Greatly appreciated. Everyone, pick up your book. And actually, Hassam, if you want to tell everybody, I know that you've got, if you want to give everybody a quick summary of your the programs that you offer and how they can learn more about those.
Yeah, thank you, Jason, for allowing me to kind of mention. I have a TMD and dental sleep medicine mastery program, a 12-month coaching program with myself. We go through kind of similar things as we're discussing today: how to create scripts, how to delegate tasks for team, how to market, network, and grow the practice. I take 10 dentists per year just to work with. if anyone's interested in chatting with me, you can find me on LinkedIn, and I have my mastery program website is dahancenter.com. So that's my last name, center.com. I'd love to chat with anyone, just know about your story, what you're trying to achieve, and hopefully we could do that together. So thanks, Jason, for that.
Yeah, absolutely. So Dr. Dahan, thank you. Dr. Doucette, thank you to all of you. I hope to see you in Scottsdale. Thanks again for being here, and I hope that you picked up a pearl or two, something that you can take and then actually put into action, put into practice to help you help more people. Thanks for being here, and keep an eye out for your CE certificate. Have a great evening. Have a wonderful Thanksgiving. We all have so much to be grateful for. If you don't recognize what that is, just take a moment, reflect. We have so much to be thankful for here. So I'm thankful for you. Have a great evening. Have a wonderful week. Take care.